Okay, everybody, here we go. I'm going to show you how this looks on an iPad. This is the same well woman exam that I showed you previously with Angela Test as a new patient, but this time we're going to do it on the iPad. So I'm taking you here right to the screen where you're going to be documenting your note. We bypassed a few of the things that you would normally do just for the sake of um, being concise here and being able to show you exactly what we want to focus on and really giving you the general layout of how this works. So here you go in a nutshell. This is your screen, and you can see pretty much everything is laid out here down the side of the screen. That basically are the tabs that you would normally follow through the different tabs, I guess, either of your visit or within your chart itself. And I'll just kind of scroll down here and I can show you what you have in here. And you can change the order of all of these tabs. You can put them in any order you like. There is that capability. This seems to me to be the most logical. I have templates up here, which basically shows you all the different templates that have been built that you can then import into your visit. And you can import them either on the fly as you enter your visit, or as the way I have it set up, which is when you designate the reason for the visit at the time the patient makes the appointment, it automatically pre-populates your note with that template. So, and then the navigation is pretty much self-explanatory. I mean, it's laid out very well here. It's a very natural kind of interface, and I think very intuitive. There are, of course, different ways to enter data into the note. Some of the fields here you can enter from directly within the note. So just by tapping on the field, you'll see over here I have these underscores here. Those are placeholders to demarcate where you can actually enter data directly into the note. So if I tap on this here, it's going to pull that up, and you see this shows up here, and it's basically showing you your placeholder. Now if I just tap directly into that, it's going to pull up a date drop down menu, and obviously you indicate the LMP. The thing about this is that if you just leave it like that, you're going to still have your placeholder. So you just have to remember to blank out. You just hit this. There's this, I just did that. Here's this X button here. When you click that, it clears out whatever's in that field. So that'll clear out your placeholder, and then you go to your drop down and you put in your last menstrual period, and then you tap down to the next field, and the next one, and the next one, and the next one. So I'm just tapping into these here. It's kind of hard to see when you're just viewing this on an iPad. But basically what's happening here is I'm just tapping with my finger or your stylus or whatever it is that you want to use into these fields and pulling up the drop-down menus that were set up in the template. And then you're done. And that just pops in there. This one is a placeholder here that actually is just set as a reminder. It's not a true placeholder. Again, these are things that if you want to customize and modify, you can. But basically, we just did the HPI here. This is just for a well woman exam. Now, assuming if this is a new patient, which is what's designated over here, NP, you're going to go through the rest of the history with her. Some of this will be done by your MA or whoever does the intake. Some of it will be done, you can do yourself as the patient comes in. So here, for just the purposes of our example, she's on Zocor, okay. Medical history, it's actually telling you here that you didn't reconcile your meds. Do you want to continue? So we'll click no. We have to indicate here taking, these little tabs, these little squares here, taking, not taking, discontinued, or unknown. And you have actually the legend is up here at the top to remind you which is which. So basically what it's telling you is you need to update, is she still taking these meds? And I'm going to click no. So then we go on to the medical history. We can add, let's see, hyperlipidemia. So we just put that in there. So you see how that I just put in lipid. I started typing and it pulled up the different options there. Then we'll go to, oh, and you got to go back here. Sorry, you're going to verify the history. What that does when you do history verified, if this was an existing patient, it would just carry over that information to the next visit and make sure that that happens. If it doesn't, it'll give you an alert. But I don't want to get too much into that at this point. We'll focus in on that kind of thing a little bit later. Allergies, again, self-explanatory. We're going to put that she has no known drug allergies. Surgical history, let's say that she had a C-section. We're going to verify that. Family history. We can say, we'll just put in here that she had a mother with a history of breast cancer. We'll put that there. This is all structured data, and you'll see it at a later time how that gets used and pulled in for calculating risk factors and those kinds of things. Now we're down to here, social history. So there's different ways to get into the social history, into the various screening aspects that you're going to be using. I have just a general screening drop-down menu, but there are also more detailed screening menus that you can get into. So this is my general screening. Here you have one for somebody who is a smoker. It'll give you more detailed about what their tobacco use is. Sexual history for somebody who you think is at risk or high risk. Drug and alcohol use. So basically, these are the general ones that would be in most cases, are going to be negative. But when you have somebody who's high risk, you probably will want to dig into these menus and pick up more options. So, and I'll just show you how this works now. So she's single, non-smoker. Those were already filled out, I guess, from a previous visit where I've used with Angela Test. But it's the same idea. The way you bring that up over here is you click on this orange eye. The orange eye shows you, if it's orange, it's showing you that you have drop-down options. If it's blue, it's usually fill in the blank. So in this case, we can pick one of the various options here from the drop-down menu, and you have non-smoker, alcohol use, just to show you what's in here is alcohol or substance abuse. If you click yes, it takes you to another sub-menu, and then you can pick from here. Let's see, she likes the wacky tobacco. Alrighty, so we'll go over here, GYN history. Same idea here with the drop-down menus. You see there's a placeholder there. So I've got to clear that out, and then I'm going to put her last menstrual period. Again, there's multiple places where you can put this in. I like to use all of them because they apply to different parts of the chart. Again, a structured data. You'll see where that's relevant later on when we start to do other examples. Menstrual history, you're going to go through her basic anemia. Was her last menstrual period? Was she sure that was her last menstrual period? Does she have regular cycles? Yes. If it's yes, then it gives you the options. If it's no, you could say she has amenorrhea. Is just what I labeled that field. But you actually have options here to say she has irregular cycles, and then you can say how long they last. Age of onset 12 to 14 days, and then we pop that in. This is these two fields up here. This is for a positive history. This is denies history. So we're going to say she denies a history of any sexually transmitted diseases, and she's never had an abnormal pap smear. Again, I could show you what those options look like. If it was yes, it would pull up all the different options there. So, but we're going to clear that out, and we're going to say she has no history of abnormal pap smears. Birth control, we already said that she was using the Mirena, but again, here's another spot where you enter it. The reason that this is in different spots is because the GYN and the OB history will carry over from one visit to another. What we recorded in the top here under the HPI as part of your presenting information does not. So that's why you're seeing some of these things in multiple spots. OB history, here's your G's and P's, so we'll put those in. So we'll say she's a gravida 1, para 0. Whoops, gotta pop those out. And, whoops. Sorry about that. Moving too fast for myself. Pop that out. There we go. Okay. And we said she had one C-section, so we'll record that up here. And again, you got to pop out the placeholders. If you guys don't like the placeholders, you know, sometimes they're irritating, but I think that they, you know, when you're looking at the general progress note, when you see up here, it forces you to, you know, make sure that you've actually accounted for everything that needs to be in there. So that's there, and as you can see, I kind of skipped through some of those, so that's why you have placeholders here that still have spots in there. Let's see here, and then you go through the rest of your exam here, and the nice part is you can either pop up to here where it says progress note, or if you pop up over here also, it'll show you, it'll do the same thing. So you can be in any of these different fields, and then you can pop back up here and it'll pull you back to the whole note so you can see what you've recorded in there so far. And then of course we'll go down to our exam, and we use the complete exam template, which is my sort of populated general exam for most patients where you have mostly normal findings. There are other exams that are more detailed that you can see over here on the side in case you want to do a more focused exam or you want to drill down to more detail. And again, I'll show you guys how that works at a later time. Right now I just want to kind of show you how, you know, the general layout works here. So in this case, let's say she has a normal exam, so you can just click on your defaults and you just merge defaults. Whoops, sorry, actually copy defaults. If you merge, it just leaves whatever is there and only fills in blank spaces. You want to get rid of the placeholders here, so you're going to copy defaults, and there replaces the placeholders. Again, there is the option to drill into each one of these, and you know, I could empty this whole thing out, and I could go through, you know, one by one, you know, filling out these types of things. If there were any additional findings, anything else you wanted to record, you know, in case you had, you know, some unanticipated findings, let's say, or let's say she had fibroids, or she was surprisingly pregnant, whatever. You could say the uterus is 10-week size, diffusely enlarged, irregular contour, and then you'd record later that she had fibroids. I'm just going to go back to this here, and I'm just going to tap there, and that's another way you can load your defaults. You just tap into the blank field here, right there, and it'll just load the defaults into each one of these fields here. Then we have our assessments, which again is preloaded within the template. These are here. Treatment. So now if I wanted to give her birth control pills, I would click on this here, okay, where we're going to prescribe. So this is for pills, this is for order sets, which we'll discuss later. These are for labs that, these are for, I'm not sure I remember what those are for at this point because I don't actually use that one. We'll discuss it at a later time. I don't want to stop the flow here. But you have your prescriptions and you have your labs. So we're going to click on the pill bottle there, and we'll put in a new prescription. Well, she has a Mirena, but just so I can show you guys how this works, I tap in low, and it'll pull up low estrin. I click on those. It'll load those up. and we're done. And then this icon up here is when you want to transmit or print something, and in her case, she probably doesn't have a pharmacy loaded in there. Oh, she does. So there you go. This is showing you that she has a pharmacy that she's given us. This is where she likes to have her prescription sent. This is her prescription. If I need to modify the prescription here, I can tap on this little pencil. Let's say we give her 12 refills. Okay, done. And then what we do is we would click send here. I'm not going to do it because this would actually transmit it to the CVS since it's actually in there. This would electronically transmit the prescription over to her pharmacy. You have the little E icon over here that shows you that she's set up for electronic transmission. If she wasn't, you would have an option either to fax or print the prescription. So we close that out, and let's see, and then preventative medicine, which is your counseling field, and you can put in whatever you want in there. You can have preloaded templates. This is what mine looks like. GYN counseling, just sort of pretty generic stuff. Now you can see there's a lot of other fields in here. Keep in mind this is your whole template. Okay, so anything that's blank isn't going to show up in your final note. It's just these are just again, these are sort of placeholders. Anything that's blue is a subheading that also exists here on the side that you might want to include. Here's your billing information. You have your code. And when you're done with your note, you're going to go up here and you're going to lock it. And it's going to verify that you want to lock it and that you're done with everything. And there's your completed note. And again, looks pretty nice. I think the layout's pretty smooth, and it's actually, to me, this is much more legible than anything that you would see as a final note, at least from what I used to see in Athena. I don't know how much better it got over the years, but this to me looks like a very familiar format that I think most of us would find very legible and easy to refer back to. And here's your counseling down here at the bottom that said preventative. I just have it relabeled as counseling. You know, that's something that you can customize. You can call it whatever you want. Just to point out a couple of other quick features here. You have this integrated clinical workflow button up here that shows you basically a summary of your patient. Okay, so you have an overview here, and you can make any one of these tabs the default tab of which it goes to when you open that up. So your overview basically shows you any major things that you need to know about, allergies, immunizations, that kind of thing. CDSS is for your screening alerts, things that you would need to use to satisfy either meaningful use or MACRA, MIPS, and those kinds of things. I forget what CDSS stands for, and I can't remember now, right? But you get the idea. You see the things that it's asking you to screen for: body mass index, cervical cancer, depression, smoking, those kinds of things. Those are all structured data that get reported out when you submit or request those kinds of reports to be submitted. You have her history here, all in one sidebar. So you have her medical history, surgical history, family history. So this is what you would refer back to when she comes in on subsequent visits. And again, you access that by clicking this. You can, you can either, you can bring it out or you can hide it over there. And it basically gives you all that information. This is a review of all of her labs, any diagnostic testing that she's had, referrals. Again, pretty self-explanatory. Here's some general information. If you have contact information, sticky notes, you can actually tab into these fields and you can leave yourself a sticky note as a reminder for this patient. If there is something in either the secure notes or if she has an allergy, you'll see this thing up here, this green icon that says for information. That'll turn red, indicating that there's something else here in the secure notes, not in the regular sticky note. In this case, she doesn't have any allergies and she doesn't have anything in the secure notes. Secure notes do not show up when you print up the patient's chart. So those for for inter-office communications, regular sticky notes do. Let's see what else. And then the hub, which performs the same function. We didn't really get into this in my previous demo, but the hub basically is what pulls up the entire patient's chart, where you can navigate to any particular major function within the chart. So you can establish a new encounter, you can review previous encounters. If we go here, there'll probably be a whole bunch for her because this is our test patient, so you can see all the previous encounters that she's had over here. You can also access that actually by punching that button. That was this one over here. Sorry, it's hard to remember to use the pointer on the iPad. But this button here will also pull up previous encounters. And you go over here where it says encounter list, and it'll give you again that same list of all her previous encounters. So this is just another way to navigate around that. And if we go into, let's say, let's find one of these visits where we actually recorded something. There you go. This was a telephone request just to show how the telephone messages work. So this is showing you that she had called in at one point requesting lab results. So again, that's just another way to navigate into different aspects of the chart. We'll spend more time focusing on the hub and how it actually works in another demo. But I think for now, this gives you a pretty good idea of how the iPad version of eClinical works. Again, I think it's a pretty nice layout. If you make a mistake, by the way, in a note and you need to go back in and fix something, you can obviously click back up here. It's going to say, are you sure you're going to do this? This, violates every rule that you shouldn't do, and, fire and brimstone, big warning that you're about to do something, that might be interpreted as maybe altering a patient's chart. Obviously, everything is logged in there. And you could go back in and make whatever corrections you need to make. We'll blank out all my placeholders here so that this note looks a little bit nicer. I'm actually using a template that I don't really use anymore because of these placeholders. They don't really need to be there. So when I go back here, you'll see that all those dashes that I had in there, I left one out, actually disappear. Let's go back in here. There we go. So now it would just look like this. So just the one C section, all the other blank spots are gone. And then when we lock the note, there it is. Okay, so it's a little different from the screen version, but again, just my personal preference, and you guys will figure out what you like best. But I do think that as you get accustomed to using this on the iPad, you will find, and I find, that it is much faster to navigate through a note once you know what to do and how to do it, which fields are fields that you can tap into directly within your template, and which ones you have to access from the side, because not all of them are accessible in here. Some you actually do have to go into each individual section to navigate, but it doesn't really slow you down. I find that once you've got your flow established, you'll know where to go next. And again, this is for a new patient, so it's going to take you a little bit longer anyway to fill in all these things. But again, the nice part is, because of that redundancy that I was showing you, is that this stuff will actually show up over here the next time she comes in. And if you want to transfer any of that data, it's not going to do it on this one because this is a new visit that she was set up for. But you'll actually have little tabs here on the side that if you want to import each of these aspects of her past history, you can actually just click that list, including the problem list, you'll see little blue icons show up the next time she would come in, and then you can just transfer those into your note. I think that's a general overview without getting too much into the details. A lot of stuff here going on, Hope I didn't throw too much at you, but I think it does give you a general idea of how the touch version works, and I think it's terrific. There really isn't anything else out there as far as I've ever seen that even comes close to this. So there you go. Any questions? Let me know.